Hey everybody, what's up? This is Jeremy with the Southeast Harm Reduction Project and Families for Sensible Drug Policy. This guy here is Mr. Adipose. He's going to be helping us out today. We're going to be talking about 8 opioid overdose prevention tips, so stick around, you'll want to see this. Hey everybody, welcome to my humble library. I've got a brand new web camera, so hopefully everything is in crystal clear Technicolor. Today we're going to talk about 8 opioid overdose prevention tips. Most of these come from a flyer that I designed that I usually pass out at methadone clinics or other treatment providers to counselors to pass along to their patients when I do naloxone and overdose prevention trainings there. I believe that every methadone patient, or really anyone who takes prescription opioids or any opioid at all, has a right to naloxone access and education about overdose prevention. And I think it's also important to recognize that people can and do overdose on their prescribed dose of opioids. So it's not just people who are misusing substances or using heroin. Anybody who's using opioids is at risk, so access to naloxone is vital. But let's get started with those tips. Tip number 1, never mix substances. I've said this before and I can't stress it enough. This is probably one of the number 1 risk factors. Mixing substances, especially central nervous system depressants like opioids and benzodiazepines, which would include things like Xanax, Klonopin, Ativan, Valium, or alcohol, sleeping medications, anything like that. Or mixing stimulants like cocaine, methamphetamine, or Adderall, which are going to put stress on your heart, and they can all be incredibly dangerous. And it's usually not like a 1 + 1 = 2 situation. Every substance that you add to the mix increases your risk exponentially. People are still going to mix substances, and that's none of my business. But if you are going to do that, I do want you to practice harm reduction and be as safe as you can. That brings us to number 2, never using alone. I realize, again, this isn't always possible. This is a rule that I violated quite frequently, and it was really dangerous. But if there's no one to call for help, and there's nobody to administer naloxone, naloxone's useless. Even if you use in a group, you should still have an overdose plan so that everyone will know how to respond beforehand and they're not making it up on the fly if an emergency situation does arise. And that's important just based on personal experience, sometimes when you're using substances, your judgment or thinking might be a little cloudy, and so you want to know beforehand what to do. With those intramuscular injection kits, even sober, I have a really hard time with those. It's really important to know ahead of time what you're going to do. With the technology that we have nowadays, I'd be really interested in looking into ways to develop an application or virtual network so that if somebody feels like they do need to use alone, that they can send out a message to someone that says, hey, if you don't hear from me in 5, 10, 15 minutes, come check on me or call for help. And if anybody's interested in collaborating on that, leave me a comment below or shoot me an email. And tip number 3, use carefully. If you're unsure about what you've got, if it's something new, if you got it from somebody else, if it just looks different, always do a test shot, or if it's something that you're taking orally or intranasally, to do a test dose. I picked up this saying along the way, and I made a habit of telling it to other people, that you can always use more, but you can never use less. And with fentanyl in the mix now out there in the heroin supply and with some of the pills and other substances, you just never know. Even a little test shot could be enough to put you over the limit. So that's why having naloxone and never using alone are so critical. Tip number 4. Be aware of your tolerance. If you leave jail, detox, or rehab, or if you return to using after a period of abstinence, like you tried to stop using and it just didn't work, start low and go slow. Your tolerance goes down really quickly. It can go down in as few as 2 or 3 days, and I learned that the hard way. The only time I really came close to an overdose was after about 2.5 days of abstinence. I was out of it for about 30 minutes and my friend was driving me to the hospital when I came out of it. So just be aware of your tolerance and be aware that if you do start using after a period of abstinence, that you're going to have a lower tolerance and you're going to need to use a lower dose. Tip number 5, never use behind locked doors. if you're in a locked house, bedroom, or car, it's difficult for somebody to get to you, even if they are in a position to help and they do have naloxone or something. And just yesterday, someone was telling me a story about her son was at a party and his friend went into the bathroom and he was taking a really long time, so he went and checked and knocked on the door and nobody responded, and he had to kick the door open, and they took him to the hospital and brought him out of the overdose. But time is always of the essence. You want to make sure that someone can get to you. Tip number 6, never share using equipment. And this includes things like syringes, but it also includes things you might not usually think about, like pipes, straws, water, spoons, cottons, and even tourniquets or belts that you would use to tie off. We don't talk about it a lot, but HIV is still a really big problem in a lot of communities in the United States, and especially in the South. And hepatitis C is incredibly common in the IV substance user community. The CDC estimates that 9 out of 10 people who have been exposed to hepatitis C don't know that they've been exposed. And a lot of people in Kentucky and West Virginia in the last few years have learned that the hard way, because they've seen really huge increases in hep C rates with the increase in heroin and IV drug substance use. In southern Indiana last year, there was a huge outbreak of HIV among people who were injecting pills, because there are so many more steps involved, and every one of those steps you have a risk of contamination. Tip number 7, locate a harm reduction or overdose prevention program near you. And I know of programs in at least North Carolina, Tennessee, Florida, Georgia, and Kentucky, and I'm trying to put together a comprehensive list for the entire Southeast, but it's not that easy because a lot of these organizations are just 1 or 2 people. Hopefully we can put that together in the next few weeks. And most harm reduction organizations provide access not only to naloxone rescue kits, but also do testing for HIV and hepatitis C, provide access to sterile using equipment, provide access to contraceptive and condoms, and also provide referrals to mental health, public health, and substance use treatment services for people who want them. And that's really critical in the South, and especially in rural areas. Where I live in North Georgia, there are hardly any mental health, public health, or treatment services. The nearest methadone clinic is about 40 minutes away. The nearest Suboxone doctor is 30 minutes away in another county. I'll include links to the treatment locators for methadone and buprenorphine doctors below. And finally, number 8. And this isn't so much a tip as it is a little bit of encouragement, that medication-assisted treatment with methadone is recovery, and even Mr. Adipose knows that. In fact, methadone treatment is considered the gold standard by groups like the Centers for Disease Control, SAMHSA, and the National Institute for Health, and many major medical experts and medical associations. And buprenorphine, which is known by the brand name Suboxone, is close to the same success rates as methadone. They have the highest long-term retention rates and are proven to improve health, reduce disease transmission, reduce property crime, reduce recidivism, which means going back to jail and prison, which nobody wants, and reducing the risk of overdose or mortality for any reason. And I've written some articles on this, and I'll include some links to those below. But don't let anybody dictate the terms of your treatment and your recovery, and don't let anybody stigmatize you for the decisions that you make, especially when it's not only a medically accepted form of treatment, but the most successful. So there's a lot of stigma in the general public and even in the recovery community, and we internalize that stigma. So a lot of that takes a lot of unraveling and a lot of work, and it's something that we have to do ourselves and within our own harm reduction organizations, and it's just a learning process. President Obama gave a really long speech in Atlanta today, and evidence-based treatment and medication-assisted treatment was a really big part of that. So it's really awesome to see that from the federal government in the United States of all places. And that about wraps it up. If you have any questions or if I missed anything, again, shoot me an email or post it in the comments below. And until next time, stay safe, and if you are going to use, Mr. Adipose says practice harm reduction, and thanks for watching. Till next time.